What is medical coding? It's not a programming language like C++ or Python. It's actually the conversion of medical diagnoses, procedures, services, and equipment into different code sets. For example, the medical diagnosis diabetes mellitus is E11.9. A carpal tunnel repair is a 64721. And these are all listed in different code books, and you can also find them in different electronic formats as well. Converting all of those diagnoses and services into code sets helps not only with our billing, but our data tracking as well, so we know how many patients have a certain condition and how many of them may progress to develop a certain other condition. And instead of using all kinds of different notes and narratives, we keep track of that through these code sets. But billing is probably the more common one that people think of. In fact, a lot of colleges and universities sell courses in medical billing and coding. If you've ever opened your medical bill, you've probably seen some of these codes on your bills before. It'll have your date of service and things like if you received an office visit or maybe even a flu shot on that date. That way they can use a database to better track when you have that flu shot, what is that cost associated with receiving that service. And that's also where we get data for things like Medicare budgets. So we know approximately how many patients have a certain condition, how much that costs to treat those conditions in a year, and we can project how much money we're going to need in the federal budget to care for those patients in future years. Even your other insurances like Highmark or Aetna or Blue Cross can use that data and take a patient that has a certain condition and compare the cost of one that has that same condition that's a smoker versus a non-smoker patient. I know that sounds like a simplified process, but there's a lot of rules and regulations that go into it that are very nuanced. And actually, if you're interested in learning more information about whether or not medical billing and coding is something that's going to be replaced by automation, spoiler alert, the automation has already been here for years and it will not eliminate, but will change some positions. You can find out more in this video that I have here on my YouTube channel about AI and medical coding. Now, all of the information on how to code is kept in these different reference books that we use as medical coders. This one is the ICD-10 PCS, which is the Procedural Coding Services. This one is CPT, which is Current Procedural Terminology, so coding for different procedures. So if you're having an appendectomy, a cholecystectomy, if you're just visiting your doctor, you're having a shot, an infusion, everything is in this book for procedures. This one is ICD-10 CM, the clinical modification, and it's diagnosis codes. So if you're having cholecystitis, if you're having the flu, if you're having COVID, if you're having a rash, there's always a diagnosis code assigned to it. This one is HCPCS, the Healthcare Common Procedural Code Set. It includes things like medications, like equipment, or even just some insurance-specific codes. And these code books change every single year. They add new codes in for new technologies. They delete some things that we don't do anymore. They revise the text on some that need to be clarified a little bit better. And there's some code books that I don't even have. So CDT is your current dental terminology for dental coding. The DSM-5 is used for mental health. Now, if you're watching this video because you're interested in a career in medical billing and coding, the average for a medical coding specialist is usually around the $40,000 to $50,000 a year range, a little bit less maybe if you're starting out. It is a great field to be in because you can do a lot with very little. It's not something where you need a 4-year degree or even sometimes a 2-year degree in order to become very successful in this field. There's so many different opportunities and niches that can be found. Medical coding has been a pretty common work from home job actually for years, which is why a lot of people are interested in it. But you have to understand that if you're going to work in medical billing and coding, there are productivity standards and there are accuracy standards. So it's not uncommon for employers to have stipulations like they don't want you watching your young children while you're trying to work because they want you very focused on making sure that everything is accurate. We don't want something to be billed out incorrectly to a patient or for them to be reported with a diagnosis that they don't have, right? So they want you focused and they need you to have a certain level of productivity. Now, of course, there's always exceptions. There's things like contract work where they're like, hey, as long as you get your hours in and you get your work done, we don't care, but that is something that you do have to consider. There's a lot of different places you can work as a medical coder. The most common people think of is either at a physician office or a hospital, but sometimes those physician offices will actually outsource their billing and coding because they want to have a team of people working on their stuff. So instead of hiring that entire team to work in their office, they outsource it to a billing company, and that billing company or coding company or revenue cycle company, whatever you want to call it, hires all of the billers, hires all of the coders, and they are hyper focused on educating them, making sure they know all the regulations, and the provider then can kind of have that peace of mind. So it's not that that job no longer exists, it's just that it's not at that provider's office, it's at the billing office instead. And someone in that designated billing office is handling all of that provider's cases. That way the provider doesn't have to worry about having to employ one more person or having to keep up with the education of that coder. They can just outsource it to that billing company. So a lot of medical coding jobs are going to be at healthcare providers and hospitals and outpatient centers, but you can also work for the insurance company directly. You can also work for vendors, people that are producing different services or equipment where medical coding guidance has to be reviewed. I've even known some coders that work for medical specialty societies, or they work with lawyers to review cases where maybe a patient is on the hook for a lot of different medical bills and they need someone who has an in-depth knowledge of coding to review all of this patient's charts, all of their bills, and make sure that everything was coded correctly and that they were not overbilled and now in all of this debt because something wasn't done correctly or coded correctly. One great thing about working in medical coding is you get all those cool perks of working in healthcare, but you don't have to be patient facing. And you'll get to see all kinds of interesting and fascinating different medical cases, read through them and kind of piece them together like a puzzle to come up with the right codes. However, it's important to remember that you are still though bound by those privacy regulations. So even if you see something interesting in a case that's someone that you know, a friend or a neighbor or a celebrity, you're not allowed to share any of that information. You have to keep that private. If you are interested in a career in medical billing and coding, you can check your local community colleges, you can check your local business schools, you can even go directly through the AAPC or AHIMA for training. I recommend onlinedegree.com. I've worked with onlinedegree.com to develop a quiz that helps my viewers find the right program for them, and they only work with accredited colleges and universities. They ask the same questions that I usually ask: where are you located, how much money can you spend, how soon do you want to be done, and they help pair you with an appropriately accredited school to get those medical billing and coding certifications. So if you use my link, go.onlinedegree.com/contempo, they can give you all kinds of special deals, but only if you use my link, and I'll have a clickable link in the description below. But if you want more information before you make that final decision, because you need to know what's the difference between coding and billing, what are the salaries, what are some of the costs associated with this career, this is the playlist you want to check out. I cover all of that information and more there. I will see you guys in the next video, and until then, just keep on coding on.